Well, good morning, everyone. I'm pleased to be joined by Dan Williams, Minister of Mental Health and Addiction, for today's announcement. I'd also like to recognize our important guests, Minor Chief Leon Littlelight of Tsuut'ina Nation, Earl Thiessen of Oxford House, and Amy, who is a mother with a son currently suffering from addiction, and you will hear more from her. I'm grateful to each of you for being here today. As everyone here today knows all too well, Canada has been in an addiction crisis for several years. No community has escaped the impact. In our downtown cores, there are visible effects on every street, with individuals who have lost the ability to make healthy decisions, actively putting their lives at risk and causing fear and harm in the broader community. And more, Alberta's rural communities are seeing the effects of addiction. We must do all we can to help Albertans who struggle with addiction, and we are. Thankfully, Alberta has made some significant progress with the development of our recovery model. We've opened 3 of 11 recovery communities and are looking forward to opening 2 more this year. 5 of our recovery communities are being built in partnership with Indigenous communities. Within provincial jails, we have established therapeutic living units modeled after recovery communities to give inmates an opportunity to turn their lives around while they're serving their sentences. Distribution of evidence-based addiction treatment medication, Suboxone and Sublocade, is at an all-time high through the virtual opioid dependency program. And of course, we have ensured that no family is forced to pay out of pocket for addiction treatment services. The result of all of our work is a positive trend, with opioid-related fatalities in the first 10 months of 2024 down 39% from the same period in 2023, and that is remarkable progress. For comparison, British Columbia's most recent data shows a decline of just 13%. Despite this positive trend, too many of our friends and loved ones are still at risk of serious harm from their addiction or substance use. And we continue to see too much collateral damage in society from drug-fueled violence and crime across Canada. This is the challenge facing our country and our communities because of policies that tolerate and even facilitate addiction. I'm again committing that Alberta will not go down that path. There is no compassion in leaving people to suffer in the throes of addiction. We will not sacrifice our communities or give up on those suffering from addiction. Aside from the heart-rending toll on families, our failed past policies now have us facing an economic threat from our largest trading partner. If Canada does not willingly take steps to get this crisis under control and stop the flow of deadly drugs such as fentanyl, the U.S. will impose tariffs to force us into responsible actions. Bringing people out of addiction would reduce demand and help ease these tensions, and it's the compassionate step to take. Every Albertan deserves a full and productive life, which is impossible when addiction has taken over. Our government has recognized this, and we're a leader in this battle. I'm pleased to announce that we're taking another step forward in meeting the challenge of making recovery possible. We are continuing our work to develop compassionate intervention legislation, and we hope to be able to introduce it very soon. This would be a tool to help individuals who've lost the capacity to help themselves and are a danger to themselves or others. And if passed, Budget 2025 will provide $180 million over 3 years towards building 2 new compassionate intervention centres, one in Edmonton and one in Calgary, to lay the groundwork for the implementation of the Compassionate Intervention Act. These facilities, known as the Northern Alberta and Southern Alberta Compassionate Intervention Centres, would have 150 secure beds each and provide proper health care for patients with complex addiction or mental health needs, much more comprehensive than a traditional addiction treatment centre. Our Minister of Finance and President of Treasury Board, Nate Horner, will be tabling his budget this Thursday afternoon. And if it passes, construction on these facilities would begin in 2026 and be operational by 2029. Building health facilities of this size and complexity takes time, and unfortunately, time isn't always on the side of those suffering from addiction. In the meantime, we're creating advisory committees to guide and support the implementation of compassionate intervention. I've also directed the minister to identify up to 50 beds in Southern Alberta and up to 50 beds in Northern Alberta within existing facilities so that we can implement the policy while facility construction is underway. I want you to know that our government is 100% committed to helping those struggling with addiction in their pursuit of recovery. This was a promise that we made to Albertans in 2023, and I am committed to ensuring our government delivers. We've been working on this issue since coming into office, and we will continue to fight this battle because everyone deserves a second lease on life. Thank you, and now I'd like to hand it over to Minister Dan Williams to share his remarks.
Well, good morning, everyone, and thank you for taking the time to be here today. And Premier, thank you for those comments to open us up. And of course, thank you to all of our supporters and validators that have come out today who know what addiction is on the streets, in their communities, and in their families. It is very important that we hear directly from Albertans that are affected by this, which we'll be doing right away. And it's an honor to be here with the Premier for the announcement. There are just a few of the people behind me that have come in support of compassionate intervention. And the truth is, we know that so many different communities are in need of these facilities that we're announcing today. I hear regularly from parents and family members reaching out to my office, pleading for a way for them to help their loved ones get into recovery. We know that recovery is not only possible in Alberta, that it's more likely than not when we provide that path, that critical path towards health care and not harm with our addiction services. These Albertans recognize that for those in the firmest grips of addiction, they have become a danger to themselves or others, and that they no longer have the capacity to make health care and healthy decisions for their own lives. As the Premier laid out, our government has done significant work to build a recovery model, now leading the decrease in opioid fatalities across the country with year-over-year of 39% decrease, a 300% higher decrease than any other jurisdiction in Canada. But this is not enough for those who are not able or willing to voluntarily find their way into treatment. We had one individual last year who overdosed 186 times, as was reported by the provincial healthcare numbers. We believe it's likely more often than that, because not every single overdose is reported and tracked for an individual. The last thing that I want to see, or anybody wants to see, is that be one of our family members or friends, and it be 187th time that takes that individual's life. We will not sit back while we watch this happen to Albertans, to our loved ones in our communities, and to loved ones in our family who are suffering from this deadly disease of addiction. Our government has made a commitment to bring forward compassionate intervention, and that legislation is coming soon. It would create a process and a path for a family member, guardian, for healthcare professionals, and for law enforcement or peace officers to intervene and request treatment for somebody who's in addiction or because of their substance use has become a danger to themselves or others. With the highest civil standards, we will move forward with legislation that allows society to care for and intervene for those who are most affected by this deadly disease. And today's announcement is laying out the foundation and the infrastructure to introduce what we need to do so that critical path can happen in Alberta. If Budget 2025 is passed, Alberta's government will put $180 million towards two new facilities known as the Northern and Southern Alberta Compassionate Intervention Centres. Constructions in these facilities will begin in 2026 and will be operational in 2029. And the Premier outlaid that we are not going to wait for that completion before we let the legislation, if passed, be able to provide care and help for those suffering from addiction. And we will see up to 50 beds in northern and southern Alberta that can be operational before then. Each of these two new facilities, 150 beds, will provide medically supported detox, counseling, therapy, and massively increase Alberta's capacity for secure mental health and addiction care to the tune of 300 new beds a year, which means potentially thousands of episodes of treatment a year. We know that we have an urgent crisis of public addiction on our streets and our communities, and we will be continuing to build addiction treatment capacity with recovery centres and partnering with third parties like Fresh Start here today to make sure we meet the need of Albertans when it comes to providing the opportunity at recovery for every single one suffering from addiction. When it comes to compassion intervention itself, Alberta's government is looking for options to speed up implementation, but temporarily using existing infrastructure for the delivery of this care. For many families, compassion intervention is their last hope at recovery and the last hope at life for their loved ones. Alberta and all of Canada has unfortunately seen too much destruction and too many lives lost to simply continue without compassionate intervention. Take a walk around Edmonton, Calgary, or your rural Alberta community increasingly to see public addiction on our streets. Talk to parents, and you will hear story after story of wondering what they can do with their child who is entering into or is already in the throes of addiction. What society has done for too long is simply not working. Enter the Alberta recovery model and this compassionate intervention facilities that we're announcing today. No more facilitation of failed policies coming out of the West Coast and activists who think that we shouldn't be trying to help people with healthcare and heal them, but instead continue and facilitate the harm. Those policies have failed. Alberta is taking a stand. We care for those suffering from addiction. We care for their dignity as Albertans. We care for them as family members. We care for the sense of public safety that is being eroded as well under the policies we see under the Vancouver model. It's time for a different path that restores hope and humanity and dignity to families and individuals. One model that puts a stop to the chaos in our downtown cores seen on full display in East Hastings and increasingly across our communities. Albertans deserve much better than abandoning them to addiction. For my part as Minister of Mental Health and Addiction, I will continue to labor and move forward for compassionate intervention in every possible sense of that word, including the legislation that we plan to bring forward soon. And thank you for taking your time, and I want to thank Amy Schiffner for her comment she's going to make about a personal story that she's had. Amy? Oh, pardon me.
Today, I'm sharing my experience regarding my son's addiction in a public setting for the first time. While this topic is deeply challenging, I believe that bringing awareness to this issue is critical. For the past 7 years, my family and I have been trying to support my son through his battles with mental health and addiction, which began when he was only 14. When we first recognized his struggles, we took immediate steps, seeking every possible avenue of help. We turned to medical professionals for guidance, attended weekly counseling, support groups, and programs to help with emotional regulation and addiction. Unfortunately, despite these efforts, things took a turn for the worse. We faced incidents of self-harm, suicide attempts, numerous emergency calls, including an overdose that was particularly harrowing to witness, a memory that haunts me every single day. My heart shattered as my son stepped away from the sanctuary of our harm, choosing the grip of drugs over the stability of our home, family, school, and a future. Each night, the silence of his absence pressing down on us as we lay awake, overwhelmed by worry and fear of where he might be and whether he was safe. I found myself making the unbearable call that no parent ever wishes to make. I reported my son missing. The days turned into desperate searches of downtown Calgary, combed through homeless shelters, and chasing down any lead. For agonizing weeks, our lives were engulfed in a suffocating uncertainty, the dread of not knowing if he was even alive. When EMS responded to a young male overdosing on a train is when I finally found him. I picked him up from the hospital and jumped into action again, desperately seeking programs, both familiar and unexplored, grabbing at anything to help him. And yet we found ourselves trapped in a relentless cycle of setback, each more devastating than the last. He has attended numerous detox centers and residential treatment, and it is essential to understand that those suffering from severe addiction may not be able to choose treatment rationally. The notion of choice is almost non-existing, as everything important pales in comparison to the pursuit of the next high. What they truly need is compassion and a safe environment to stay in until they are sober and ready to re-engage with their lives. Long-term treatment is necessary for individuals to have the time to regain their cognitive abilities, relearning life essential skills, and distance themselves from the harmful influence that fuel their addiction. As a mother, I should have the ability to ask for my son to receive secure addiction treatment as one would for a loved one facing psychiatric challenges. An individual in active addiction typically do not believe they need help. They will insist they are fine and plan to get clean soon, yet this is often not possible without significant intervention. Today, I feel hopeful. I am grateful for Alberta's government because they have acknowledged the growing crisis in Alberta and are committed to proactive programs aimed at saving our loved ones. I believe compassionate intervention could break the cycle of addiction, repeated treatment, incarceration, homelessness, and the ultimate fear of death. We must intervene to help people like my son reclaim their lives. Thank you.
Thank you very much, Amy. I'll now invite up Earl Thiessen, to deliver his comments. Thank you.
Thank you, Amy. Thank you, Minister, and thank you, Premier. Hello, everyone. My name is Earl Thiessen. I am the Executive Director of the Oxford House Foundation of Canada and an alumnus of our program. That being said, I am also an Indigenous man in recovery, formerly homeless for 7 years, and in recovery from pharmaceuticals, alcohol, and cocaine for over 17 years. A survivor of every type of abuse you can imagine. I need everyone to understand that this is life or death. This really is not about anything other than the need to be compassionate about people in the state I was in. It's about those who no longer have the capacity to make safe, conscious decisions for their own well-being and safety. Take a walk around downtown Edmonton or Calgary. Come down by where my main office is by Chinook Station. My heart sinks in my stomach, seeing people in a state where they no longer have the capacity to function. Seeing young ladies unconscious on the sidewalk, vulnerable and unsafe. Is this now a society that's stepping over these poor souls, shaking our heads and being totally baffled as to how they got there? I would like to think not. I have dedicated the last 15 years of my life to finding solutions and advocating for healing. I've created vital housing models to support people seeking recovery, but where does it start? Are many so far lost in their addiction and trauma that the ability to make a life-saving decision of their own free will is no longer possible? The answer is yes. Yes, there are hundreds of people in the state who are a danger to themselves and others. What is the solution? This is the question we ask time and time again. Is it a compassionate approach to step over people on the street and allow them to die in front of us? Turn our heads and ignore the obvious because it's their right? No, it's not. And for those that say it is, you have never been on the other side of the phone, listening to a mother or father crying, begging for help for their children, asking why nothing can be done to help their child, who is wandering around aimlessly in constant danger of death, unable to make that decision for themselves. I have been on the other end of these calls more times than I care to remember. It's devastating. It's time for us as a society to take the direction of compassion and caring and have proper, secure, safe facilities to stabilize and provide the opportunity to heal. To put this in perspective, my wife and I are raising our 6-year-old niece because my sister-in-law could not decide to heal on her own. We have had this little angel for almost her entire life, since she was 3 months old. She calls her mom, Mummy Amy up in heaven. Let that sink in. It's time to take some serious action to help provide the opportunity to stabilize people and provide support until they're able to make those coherent decisions to heal and to be the people our loved ones have the potential to be. There are 3 ways addiction ends: jails, institutions, and death. It's time for change, a change in our approach to turning our heads at the devastation around us. It is not compassionate to allow our loved ones to succumb to the throes of addiction. It's time for action. Protecting a person's right to refuse treatment when they lack the cognitive capacity to understand their illness is not true autonomy. It's abandonment. Thank you.